because I'm like, who is this?
No, sorry, I'm from
It
Indiana.
didn't even dawn on me that I was expecting your call, so I apologize.
You're fine. Do you want us to just get started with questions right now?
Sure.
All right. What first attracted you to being a PA?
So, honestly, when I started at Otterbein, I thought that after athletic training, I wanted to be a physical therapist. And it wasn't until probably, I bet you end of my sophomore, maybe beginning of my junior year, that I realized that I really didn't want to do that, but I didn't know what I wanted to do. And one of my professors actually suggested shadowing an orthopedic PA to see if I would like it. And once I shadowed her, it was like, well, this is exactly what I want to do. It's hands-on, it's patient care. It made sense at that point.
Okay.
But before that, I didn't even know what PA was.
Okay, what surprised you most when you were trying to become a PA?
I think the whole application process. I didn't expect it to be. I didn't realize at first how competitive it was to even get into school. And once I kind of got over that, I don't think really much else surprised me. Because as you're kind of going through the whole process of getting ready to apply, and you kind of figure out exactly what the schooling's going to look like, and it kind of makes you realize, what area you want to focus as you kind of get into school.
Where did you go to grad school?
Philadelphia University.
Okay.
Hi, Miss Greene. This has been, I'm another student in this class along with this group. And a question I had was, like you said, it was competitive. Like, as far as that goes for graduate school, what do you think you did to kind of prepare yourself and set you apart from other students that gave you an opportunity to be accepted into grad school?
Yeah, so the biggest thing, especially, and I'm sure it's with all grad schools, but whatever you can do to set yourself apart. I mean, everyone's going to come in with the same classes, the same GPAs. It's more like when I was at Otterbein, I was part of the community service team, so I had a lot of community service hours that I think not many people had. And I used that to my advantage because the schools that I was applying to really focused on helping the underdeveloped and the underserved. So I think that helps me a lot. But anything that you do that you think is different, whether it's if you're involved in athletics or some kind of organization, just put everything on your application because you never know exactly what the school you're looking for.
Yeah. So was there other schools that were high on your list that you picked Philadelphia over, or?
Actually, it just so happened that when I was applying, most of the schools that I applied to were in Philadelphia, just by sheer coincidence. When I was applying, I tried to look at schools that met the prerequisites that I already had, but I would only have to take maybe one or two additional classes. And like I said, it just so happened that almost all of the ones I applied to were in Philadelphia.
Gotcha.
So what does a typical day for you look like? Like, when does it start? When does it end? What are you doing throughout the day? Is it, like, the same thing? Or, like, how many patients do you see?
Sure. So I work in orthopedic. So every PA that you would talk to is probably, their job is a little bit different depending on what field they work in. But for me, right now, we see patients mainly on Mondays, Thursdays, and the occasional Friday. I see anywhere from, my schedule usually looks like about 10 to 12 a day. I see patients on my own. The patients that are normally on my schedule are preoperative consent appointments, so I'm doing a lot of preoperative education with patients, doing a lot of prescriptions for things like crutches and canes and walkers. And then I also see our 2-week follow-up patients. So anybody that's had surgery with us, I see them 2 weeks later to do their wound check, take out sutures, staples, whatever they may have, and kind of check in on them. So then at that appointment is when I'm doing a lot of, like, refill medication prescriptions. So for us, it's a lot of, like, Percocet, Tramadol, things that you would get after surgery.
Okay.
When our practice was at Ohio State, I would also see, like, our 3-month follow-ups. So people that are doing a little bit better after surgery, and it's just kind of like our last check-in point. That's what I do on clinic days, and then on OR days, I actually first assist during the surgeries. So we do hip arthroscopy. It's minimally invasive. For those, I do a lot of positioning of the patient, moving their legs. We put in anchors into their labrum, so I do all that. And then closing the wounds, just doing all their stitches. And then we also do total joints. And the total joints I'm a little bit, I would say, more involved in than the scopes.
So would you say your specialty is like orthopedics?
Yeah.
So how did, like, when you were in grad school, like, when do you start to decide, like, what specialty you want to go into?
Well, that's the beauty of being a PA. You never really have to decide. If tomorrow I decided that I didn't want to do orthopedics anymore, I wanted to go back into family medicine or women's health, I can do that. We are board certified across the board, so you can work in any field that hires PAs. It's just, the knowledge base, really. You're trained like a med student would be trained, so you're trained in kind of all the fields. It's just which field you choose to go into and use that knowledge in.
So you said that you originally were thinking about being the PT, and you were looking at that the first year or so of college. What do you think made you want to go into PA over PT? And then, like, even if you were thinking about, I don't know if you were thinking about like being a doctor or at all, or like what separates like PA from those two? Do you think that like makes you want to do that instead?
Yeah. So when I changed from like the PT route, we actually had a rehab class as an undergrad in athletic training, and when I was shadowing with the physical therapist and going through that class, I didn't think it was the right fit for me. I was a little bit, I don't want to say bored, but it didn't interest me like I thought it would. The hands-on, more kind of direct patient care, making the decisions, interested me a little bit more. And then as far as med school, honestly, initially I don't think I had the confidence to apply. I didn't think that I would ever get in. And kind of as the more I looked into PA, it was a nice option because you work under a physician, so you always have someone to bounce an idea off of and talk to and collaborate with. It's not like you're out there kind of on your own practicing and you have to be the one that makes the end-all, be-all decision. I like kind of that safety net involved.
Gotcha.
But as far as like PAs, I mean, PAs, I don't know if you know like what a nurse practitioner is, we're very, very similar. We do this essentially the same thing. So it's just we're taught in two different models.
Okay. All right, well, I think that's all the questions we have for you. Thank you so much for taking the time out of the day to talk to us.
Oh, you're more than welcome. And again, I apologize that it didn't register that I was waiting for your call. That's who the call was from.
You're fine.
But if you guys have any questions, I know you have my email. You can always email, and I'll get back to you.
All right, thank you so much. Have a nice day.